Hi guys, it's Dr. Selene with BU Medical. Today I want to talk to you guys about plasma pen. It's one of our new technologies that we're using mostly to rejuvenate around the eyes. We have lots of different modalities of different lasers that we can use for the whole face. You've seen this sometimes on Instagram or on different social media outlets where you see this all over the face, little grid marks everywhere. Where I feel like it really shines is really around the eyes. And then when it comes to lower face or other parts of the face, I feel like there's other lasers that are more helpful for those areas. But today I want to show you kind of what this process looks like to rejuvenate the upper eye area, including the lids if you want, just to tighten up that skin, take away that crepiness that's really hard to do with Botox and fillers alone, and actually rejuvenate that whole eye area. You're going to see before and afters that are beautiful, they're pretty remarkable, and I haven't seen very many lasers that can get this close to the eye and give you these type of results. Take a look and see how this process comes along. Okay, so we're gonna start off. Britta's already been numbed around the eye area with some topical numbing medication, and I'm gonna top her off by putting a little bit of injected numbing medication. This helps so that way she doesn't feel a thing during the procedure. It's a little bit painful at first, but she's going to have a no pain procedure. Once this medication is in place, you're gonna see it's gonna swell up her lower lids, which actually gives me more access to the skin of opening that area up. And so this is a little bit burny for Britta because it has the lidocaine in it. But again, this is the same kind of process that we do when we're doing tear trough filler. Okay guys, so I let that settle in for a minute. It's just gonna be a little bit swollen on the under eyes. Again, I want it swollen because I want that tissue to kind of push out at me so I can get access to those little grooves. So this is intentional both for anesthesia, but also for your results. Because you can imagine if that groove is hiding in there and not popped out, I can't resurface it. So if I can pop it out with a little bit of fluid, then I can really get in that line and erase it. So here we go. This is the fun part. Britta's nice and numb at this point, so she should be pretty comfortable. If she needs more numbing medication, we can always stop midway and numb up a little bit more. This is just the plasma pen. You can just see this little guy here, and if we get up close, which we will with this video, you'll see how it reacts with the skin to tighten and create more elastin, collagen, and resurface. And because it's got this super tiny fine tip, we can get really close to the eye, which is the whole goal around the eye area. And you can see how comfortable Britta is, and that's because she already is really, really numb in here. Had we not done that extra numbing step, this would be a little bit more painful. And you can see these little tiny micro injuries are what we're looking for. We let these little guys crust off on their own. We don't touch them, we leave them alone. So remember, this is gonna take about a week to heal. We wanna see you after 2 weeks to make sure you're progressing in the right direction. We'll compare them to your before pictures, which we'll take on your initial treatment, and we'll show you the improvement. But remember, this gets better over time. So what you see at 2 weeks isn't necessarily what you get. Remember, it takes time to rebuild collagen and elastin. So right after we're done, we're gonna put some cream on the under eye. I actually also sneak in liquid sunshine, and I think this is gonna help with the recovery process. When you are at home, you're actually going to use a little bit of powder on the area as well. You're just gonna let these little injuries fall off on their own. So you just keep it a little hydrated with a little bit of recovery powder, and over time, those little areas just kind of fall off. You're gonna see me just kind of moisturize this, and that's going to help with the healing process to keep it moisturized. You don't want to put makeup on top of this for about a week until these little crusties fall off. So liquid sunshine is an amazing oil moisturizer, oil-based moisturizer. It helps with healing. It's got 1,000 milligrams of CBD, which is super, super healing. It's what I've found to be the most healing after any and all lasers. I love it, and to me, it's a staple in every day, but especially post-procedures. Whether that be injections, lasers, anything that requires healing of the skin, it's my go-to. All right guys, so you can see how awesome Britta did. It was an easy procedure after the numbing part. Remember, it's just that numbing part that's the hard little commitment, and then after that, it's easy sailing. It's an easy procedure. The hardest thing about it is the numbing and then the healing time. And the healing doesn't even hurt, so you don't need to be worried about that. We do have other lasers that are a little painful post-procedure. This is not one of them. So remember, if you're curious about this, do ask your provider when you're in there seeing them for other areas. If you're getting doing Botox around the crow's feet, ask about SubnoviPen, take a flyer. Make sure that they're explaining it to you and you've seen the process now. It's straightforward, it's not complicated, and you get great results. Remember guys, we want you guys to look great so you can feel great, so you can do great things. Take care.